Namaskar, good evening. A very warm welcome to all the students of Post Basic BSc Nursing program and all the regional directors and PICs and academic counselors who are attending the session today. Today the topic has been chosen from Community Health Nursing. It is a practical oriented topic and it is taken from BNSL 209 Practical Manual 2 Unit 2, that is on social mobilization skills. So the topic will be covering in detail what is social mobilization, what are the benefits of applying the skills of social mobilization, and what are the uses, and what can be the types of social mobilization, how you can mobilize the community, and the qualities of a social worker or the community health worker who is working in the community. So let us start with the what do you mean by social mobilization. As you know that it is the very important aspect of community health program where you are going to develop relationship with the society or community, the family and the individual in the community. And until unless you have that rapport in the community, it is very difficult that you will be able to work. So how you are going to mobilize that community for their benefit only. Once you have mobilized them, you have made them aware, or you have strengthened their skills to take care of their own health, then you are able to achieve the goal of social mobilization. So let us come to the meaning of social mobilization. Social mobilization is undertaken for the purpose of social change, and it involves masses. It does not that you are just dealing with an individual. You are trying to make them together and be a strength in the community so that they can work for a common goal in the community. So all mass movements are based on the principle of social mobilization. If we see the Oxford dictionary meaning of this social mobilization, it is the process by which individuals or the section of society mobilize in order to effect the social change. And social mobilization is not a single event. It does not mean that once you have done it and it is over. So it is not a single event, but it is sometime a very long drawn process and may take even months or years, because you have to develop the rapport in the society, and to develop rapport in the community is not very easy. So sometime you have to meet them once, twice, or over a period of time. So it can involve a long process also. And however, some social mobilization takes only a few days. So it depends upon the what kind of action you are going to take in the society, and based on those actions, it can be a long process also, and sometimes you can achieve your objective in a short duration also. So how you are going to approach the community? By door-to-door outreach services, or you meet them in person and at the level of the family to mobilize them, to make them aware, and also you can meet them in the public meetings as well as by arranging health fairs. You must have come across many of the health events or the health melas in the name of health mela. Sometime it is on the dental health or communicable diseases, or sometime we organize on non-communicable diseases. So these health melas are very effective means of bringing the people to your services, and so that they can avail these services. And it can be also participatory theatres as well as many other activities can be there to mobilize the community. So if we see the social mobilization, it is a dynamic process, and it uses the channel of communication, and the channel can be traditional, it can be modern, as well as the cultural order to get the members of the population to join the social responsibility for the development of the society. So you use various means, sometimes the traditional methods or the modern technology also, as well as the cultural pattern which the community is very much familiar. So these things help the community to participate along with you, and you are better working in that particular community. So all the social mobilization do not follow the same path. It will depend upon the topic or the theme for which you are organizing that particular activity. So some stays for a long, as I told, it can be a longer duration, it can take place, and some stay for the shorter period. So that is immediately after the goal is achieved. So your work is over and you further move. So it can be short term also. So whenever it rises suddenly with a specific goal or grows as a wave over time, the process usually leaves an impression on people who participated in it. So, once you have developed or you have organized an event and that event was so successful that people are taking those memories with them, and they will always remember that this program was organized where I learnt these particular skills, or I learnt got aware about a particular topic, and they always remember it. So it can become very effective. So the process of activating a large group of people in a given community to participate in an event or activity, or the process of social nature which is intent to bring about a change. And what change we are talking in the society? That change is in the people's attitude. Sometimes they have very negative attitude towards a particular, suppose patients are there with tuberculosis, and the attitude of the people that this person is suffering with tuberculosis in this family, so nobody want to visit that family. So because of their negative attitude, and so once they are being taught that this disease does not spread with this particular thing, or it is not to worry, or everybody should support that person in the society, so that will bring about some change in their attitude. As well as if we provide them, create awareness about the same topic, how it spread and what are the signs and symptoms, how they can be early identified and get diagnosis and full course of treatment, so they can be cured. So if that kind of knowledge is provided, so it becomes the change in their knowledge as well as change in their attitude also. So it is very important to see what kind of actions are required at particular topic. So essential for gaining the support of masses, we need the social mobilization skills so that we can organize or we can motivate large number of people in the community, so that they are able to, we can take cooperation from them, we collaborate with them, and we are there to assess their needs. If we have felt needs or we have assessed their needs, then we are able to plan the action as per the need of that community, because it is the need at ground level. So it is very important that we need to know about the community and tell them about the that particular health topic, so that they accept it. And once they accept that yes, what has been told to them is right, so they approve of it, they try to adapt it as well as they adopt it, and this will help in the bringing about change in their behavior also. So this is the why it is important that social mobilization is needed in the community at ground level. So for as a community health worker, you must know the background of that particular community. You must know their cultural practices, their way of living, as well as what kind of thought they have. So if you are familiar, then it is easy for you to take cooperation from the society. So if we see the benefits of social mobilization, it enhances the capacity of the individual. Because you are meeting every individual, from there meeting the group as well as the community. Why we are meeting them? To identify and fulfill their needs, because we want to assess what are their health needs. Then other benefit is it increases the community participation. This is the most essential aspect in the community, how we are gaining their cooperation. Because if the community is involved in the decision making process, so we can take the felt needs to the higher level also, that this particular community is having this kind of need, and if we fulfill that particular health need, so they cooperate with us. The community will have trust in the health worker, and also help to improve the program design. Because once we have felt their needs, as per their needs we have planned the program, what is required for them, what is best for them. So that will help in designing the program. Also it helps to improve the quality and the results of the program. The result will be successful. The program will be more successful if it is as per the need of the community. It is also cost effective way to achieve the sustainable results. So once we are with the community and doing the services or planning the services as per the health need of the community, so it becomes more effective. And once it is effective, so it becomes more cost effective also, because we are not unnecessarily using other resource material which is not required. So these are the benefits of social mobilization, as well as it also increases community ownership. It enables the communities to determine their own development, because we are doing as per the need. It helps to build the trust within the communities so they can work together effectively. It increases capacity of the communities to work with government and other sectors like health services as well as the research. So help to apply the political pressure and create positive change. Once the health needs are felt, and these health needs are planned in such a way that we communicate this message that this particular community has this particular problem more, and this message goes to higher authorities at the planning level, and even at the political level, and then the order come from the upper to the downward side to in favor of that community. So it will help in the development of the community. As one of the example if we give is the under National Health Mission, health and wellness centers are developed in terms of the infrastructure, in terms of the trained manpower, as well as in providing adequate equipments in the health and wellness centers. And these health and wellness centers were the felt need of the community, that at the grassroots level they need better health services. And to provide those better health services, since the launch of this health and wellness center scheme in 2017, a large number of people are getting benefited and they are availing these health facilities, so which is helping in keeping the population healthy even at grassroots level, and the trained power who is working with them, and they are assessing the health need, they are organizing health camp from time to time and finding out what all can be done to improve on the health services of this community, and many people are participating and availing these services. So need of social mobilization. Is it required? As I told you in the beginning, this is the most important aspect in the community, that you work with the community, for the community, or the people in the community for their benefit, and by using these social mobilization skills also. A proven development strategy that has helped people around the world identify and address pressing issues, because social mobilization proves the development because of we identify the health needs and try to resolve their problems. So for making any community-based program successful, and it's not only making it successful but also to sustain its applicability, the involvement of the community from planning, from implementation, monitoring and evaluation is essential, for which there is a need for the mobilization of the members of the community and other stakeholders also, who can be involved in the program. So we need to see what all stakeholders can be involved, what all helps can be taken from the people in the community, and so that any program which they plan or implement, and also then do the evaluation, like afterwards evaluation was done whether how many people are utilizing these services in the health and wellness centers. If at the beginning of the program only one person per day was coming to health and wellness centers, but then when the evaluation was done later on after the implementation of the program, it was found that more than 30 persons are availing these services per day. That means people are mobilizing, people are now trying to have faith or trust in the health services, and large number of people are now coming and availing the health facilities in the health and wellness centers. So the first need of the social mobilization is to create awareness. That means just like when we impart health education, same way the purpose of giving health education in the community is to create awareness and to provide them more knowledge. Same way in the social mobilization also, here it is not involving an individual but to the masses, as we told, in a large number of setting, maybe the whole village is involved. So in the village we are creating awareness, so the aware community can identify their problem. Once they know about that problem, yes, and they can even identify that person is having these symptoms. Once they have come to know that these are the symptoms of a particular disease, and we have made them aware, we have provided them knowledge, so they themselves can identify now that person in my locality is also having similar kind of symptoms. So they felt need they can identify more persons with the same disease, as well as they can demand that now this is my need. As I have come to know that suppose a diabetic patient, so he knows that my blood sugar to be monitored on a regular basis, so they can also demand that my blood sugar should be monitored on a regular basis. So it will help to develop the culturally appropriate strategies and the messages. Depends upon what kind of culture or the background is there of that community, and keeping that in mind, because the worker or the health professional who is in that community, they are aware of the cultural background also of that particular community, so they can help them in that way, what is good for them according to their culture. So this also help to increase the people's skill It will also help to increase the knowledge as well as the confidence, and also install in them a belief that they can make a difference. Once you have empowered them with the education or some of the skills which they can learn, so you mobilize them and ask them to maximum participate in the health related events, whether in the form of organizing health fairs, or you have disseminate the information using posters, charts, that this is the day the one health camp is organized, and let maximum people come and participate. And people are also listening to you and coming. This means that you have mobilized the community, and now they are mobilized means you have moved them, that now they are listening to you and they are participating in the health related activities as per your direction. So other need of the social mobilization is, first need is the creating awareness, second is the community participation. So involvement of the community and the stakeholders in the program increases effectiveness and efficiency of the intervention. Whatever intervention you are going to do in that particular community, so they take participation and also obtain additional sources and support to make the program cost effective. Suppose now one of the example is in the rainy season. It is rainy season in many of the states, and you find that in rainy season more of the diarrheal diseases are common. Dengue, chikungunya and the vector-borne diseases, malaria, they are very common. So you before the occurrence of the event, you can mobilize, you can create awareness that how you can prevent yourself, what is your responsibility to prevent yourself from the vector-borne diseases, how you know all those methods how to prevent. So you make them aware in the larger group, so that they, each and every individual of that community, after getting aware, can take those measures which will prevent them from getting the mosquito bites, or preventing themselves by using mosquito repellent or some mosquito nets and full cover of clothing, so that they don't expose. So these are the ways, and if they are aware, so they start taking these measures collectively together in the community, and protect not only themselves but to the entire village. So it also helps in reaching the most vulnerable and the needed member of the society. Once you have seen that there are some of the houses which are far away, or across the river, these people are not getting involved with the other, so you try to mobilize to them also, that they should also not be neglected. If they are vulnerable, they should also be taken care of. So you try to reach them first, try to build rapport with them, and then you make them sure that they also participate whenever the health fair is happening, or when you are organizing some health camp or this kind of activity where you are going to create awareness. So this will help in the participation of the community. Other need of social mobilization is increasing the community ownership and the sustainability. The social mobilization is needed for developing the community ownership. This means, suppose there is a Swachhata Abhiyan, or you want to say that this particular village is very, very neat and clean, and they have very proper system of controlling the waste management system, or they are not putting their waste here and there, but keeping it all the time clean. People are getting responsible, that individual is responsible not to spread the waste here and there. So this helps in increasing the coverage as well as access to the information and the services also. So there is you can identify that community, and if they do it on a regular basis, so that particular activity can be sustained also. Empowering community, again, the social mobilization activities increases the capacity of the stakeholders in decision making. Once they are aware, so they can be part of decision making, and decision making empower them. So they take planning, they are participant of the planning of the program, implementation as well as in the analysis. So when a community is empowered, so people feel free to act within the society. They don't feel that I am doing this wrong or right, because you have empowered them, you have bring some confidence in them that they can do something good for the community, and at the same time associate a sense of belonging to it, and they feel that yes, I am a good citizen or good participant of this community. With this, we will take a break of 5 minutes, and we will come back to you with the same topic. Thank you very much.
We wear clothes on a daily basis. But have we ever wondered, where do our clothes come from? Who makes our clothing? And who are the people and the process responsible for the whole manufacturing of our clothing? If you want to know more about this, Indira Gandhi National Open University from the School of Continuing Education has launched a program which is Certificate in Apparel Merchandising. There are many benefits after doing this program. You can become a designer in various fields. It can be fashion designer, apparel designer, costume designer, or even a textile designer. One can also work as a fashion consultant. Research and development is another field which one can take up after doing this certificate course. Going into academics is another perk after doing this program. Getting into fashion houses or fashion studios as an intern is also a very good option post doing the certificate in apparel merchandising. The basic eligibility of the program is 10+2. The duration of the program is 6 months to 2 years. The program is also available for both the admission cycles, which is July and January. The exams are conducted twice a year, in June and December. So what are you waiting for? Join this program and get an enriching knowledge in the field of apparel merchandising. And to do so, you can log on to the official website of the university, www.ignou.ac.in.
Welcome back to the same topic on social mobilization skills, which is taken from BNSL 209, Practical Manual 2, Unit 2, and for post-basic BSc Nursing students. I was discussing about the meaning of social mobilization and the uses of social mobilization, need for social mobilization, and as the most important use of social mobilization is to gain the public support for the policy and the program, product or the activity or the service. If we are involving people in a large scale activity which the agency wants to be completed within a specific period of time, within the suppose camps and the campaigns, so it is very important that that time social mobilization skill plays very important role, that you have gathered a large number of people together and you have organized in a very effective way within a short period of time, and many of the people have been made aware about certain things. So this is the most important use of social mobilization skills, and these are very effective in the community. And to sustain the development through the involvement of people, because what it is the involvement of people in creating the awareness, so enhancing the process of behavior change. We try to bring about a change in their behavior so that they become effective and community development takes place and the felt needs are being taken care of in the form of creating the change in their behavior, and also to ensure that the desired change take place faster. It is not that you are just so you want them that they should change their behavior faster, which is possible by enlightenment of the people or including the people, because they even when once you have taught them is okay, and after that they try to discuss with each other and try to have their own ways and means to learn the things from each other also, and that make them learn the things faster. So it helps to understand the felt need of the people and also help to empower individuals and the group for action. So now we will come to the types of social mobilization skills. So we can say that there are two types, like controlled and spontaneous, as well as specific and general. So once you have idea of this types, then it is easy for you to take action in the community. When we say the controlled mobilization skills, it starts outside the people who are part of the process. The planning and the initiative are done elsewhere and the people are only passive. Controlled, in which the people are not participating but the decisions are coming from up higher level, that this has to be done. So here people are not participating, but the organizers or the at higher level decisions are taken for the people and it has to be followed by the people. So it is a controlled kind of mobilization skill. They may be convinced even enough to become more active forces later. Once the decision has come, people have to follow that decision, and later on they may try to adopt that change and may even take hold of the movement and carry it forward. For example, if we say the immunization awareness about the benefit of immunization and adopting the practices. It has been told that it is prescribed that this is the immunization schedule and everybody has to undergo immunization. So this decision has come at this age, child has to be given this immunization and people have to come and take these immunization services. So it is a controlled decision and everybody has to undergo immunization. So this is controlled kind of mobilization of the people in the society. Then the family planning, another example where the sterilization camps were highly effective in mobilizing the entire nation into accepting the tubectomy or non-scalpel vasectomy as the best suited form of birth control. So these are the decision and the controlled kind of social mobilization, and where people are given this choice to participate. And then controlled mobilization also starts other one is I have told about controlled. Now the spontaneous. Another is the spontaneous type of social mobilization, in which the spontaneous movement starts out of the people's own reaction to actual or perceived wrong and injustice. The reaction may be against the establishment or other agencies and the individuals. Sometimes something happens and spontaneously, there is no rules, regulation followed, immediately, spontaneously people are also reacting. So that becomes spontaneous. The mobilization is sparked off immediately through a recent event which affect the people's life or the emotions. The initiators are filled with zeal and enthusiasm. Either they have hatred movement, or they have some enthusiasm, and in that everyone would like to participate and contribute to an activity. That is the spontaneous reaction. So this highly charged and intense phase, spontaneous is highly charged and intense phase, and it is short lived. It just happened at that particular event. So the initial enthusiasm dies down and the people go on to other interests. So it happens and it goes off. For example, a maternal death in a village. Suppose a mother dies in a village. So when you went around to invite villagers for a meeting to prepare an action plan to reduce the maternal mortality, and you went and you want people to participate that how you can prevent these maternal deaths, so you will find that it is easier immediately after this event, because it is just has happened, a death has just happened and people are thinking about it. So you want to take their support or their felt need at that moment of time, so they will come out with more ideas at that moment. So hence you could mobilize them easily. So spontaneously means once an event has just happened and you also went there and try to take the opinion of the community that how you can prevent this maternal death. So they spontaneously they react and they can tell many more things that yes, it should be, because they are highly charged at that time. So this is the spontaneous mobilization. Then other type is the specific and the general. In the specific, issues related to the group of people or daily living are taken up as the content of the social mobilization, like the anti-liquor movement deal with one issue for which there was large scale social mobilization. High level of participation of people after a natural calamity like cyclone in the Bay of Bengal or the earthquake, like specific issue. Once the large number of people are affected with the common interest or specific like earthquake or some calamity, then all the people come together to help each other. So that is another specific issue on which you can also take the lead and ask people that what all are their needs at that time and what action can be taken. So specifically for that particular activity you try to mobilize the community. Another example is the high level of patriotic enthusiasm and activity during the Kargil conflict. Like all political parties try to mobilize people to their way of thinking for a specific purpose during the elections. In the same way, mobilizing support during the pulse polio or other national program is for specific purpose. So most of these are very short processes. So specific issues are emerged in the community, and specifically you are working for that, and then it goes off. So as and when the specific issue arises, you take measures and then it goes off. On the other hand, general type of social mobilization, the purpose of this type of social mobilization is overall development of the people. For example, the mobilization for introduction of the local self-government through the 72nd Amendment of the Constitution, in which the Panchayati Raj is with the goal of achieving the more decentralized process and enhancing people's participation. Here the decentralization again means the community can tell their felt needs and their participation becomes important, and in the Panchayati Raj was given the power to ask the people, and through Panchayati Raj it can again highlighted at this higher level or at the center level, and from where the issues are taken care of. So this general mobilization takes place longer to start because the decisions are taken at this level, and then from here they will reach to the next higher authority, from there again to next higher authority. So this may take longer to start as well as to maintain, but once introduced it lasts longer. So once a rule or the is established, it can last longer. So the in general, again, the campaigns are well planned and systematically conducted activities for a specific purpose. Social mobilization may not always be a planned activity. You cannot say that you have planned something for the community. It can also happen that some issues, they just emerge spontaneously also. So it may start due to an incident or may go beyond the specific activity also. So social mobilization may form a part of a large campaign or the program. So you try to see from step by step how you can plan for an activity and how you can make the participation of the community for a common goal, and which is good for that community, which will help that community, which will empower that community at a larger scale. So this will help in the social mobilization. One of the example is of the health professional at a grassroots level. So they want to mobilize the people in the village. So for avoiding the irrational use of injections. Suppose they don't want, they are seeing that people are just now and then using painkiller injections, and every time they want that today I am having pain, please give me this injection. So, and you as a community health worker find that people are irrationally want to use these injections. So how will this person start and make a progress? Will she call for the village level meeting through the village president, or announce through the village public address system, or visit each house? Which is the best way to start? So all these things she has to prepare, that what problem or what event is emerging and whose help she will take to find out how to solve this problem. So when the people on a large scale have to mobilize for a specific purpose, it is not always necessary or when to start with the actual issue. An entry point sometime is paramount importance to them is required, which will outreach the people. Some example of entry point for social mobilization is like current problem of the people. the people are more likely to listen if it is current problem, giving them trouble like recent floods or epidemics, like any issue on problem like which affect the majority. In such a case, the community mobilization can get the attention of the majority of the village or the basti. So dealing with the problem of the majority will show that the difference are forgotten and togetherness is built, because until unless the community come together, then only this will help later in the process of social mobilization. If each and everyone is fighting on their own issues, then it will be difficult to handle the problem. Now we will come to the prerequisite for the social mobilization, what all is required, purpose or the goal for which mobilization is required. You should have a purpose for the social mobilization, and the leader who will inspire and encourage the participants and spearhead the movement. A leader has to take great role in making the community come together and fight for a common cause. So a symbol for the unification or unity and building togetherness, you can prepare some slogans, banners, even songs will attract the people, badges, then message which are used for the mobilization, and the content of these messages in the form of speeches, pamphlets. It can be, you can use the booklets and the songs to keep alive the involvement and the interest of the community. So you can, these things you will have to prepare beforehand once you want to start with your campaign. So you also need the network of the managers as well as the workers who will organize and take responsibility for different components of the social mobilization. You will have to assign duty to various, because you are not alone or single person. You have to take help from the various stakeholders as well as the people in the community and various volunteers who are there. Then again, for doing any activity you also need funds, so which will help in keeping the intention and action closer together and make sure that the intended activity are carried out without any obstacle. Until unless you have some funds to do that activity, then only you can plan it. So publicity and the news, you need to publicize also in the form of media coverage, latest reports, including the efficient system of dissemination of the information. How you will disseminate this information, that today we organized this activity, like whether it will be coming in the newspaper tomorrow, or you are making a short video of it which you can put on the YouTube, that this activity will be there in that particular community. Suppose you want to organize this social mobilization at village level. It is not easy task, because every community has its own beliefs, values, culture, leadership, social system, social groups, religion and the interest. So it is not that easy. Hence it is necessary for the social mobilizers to understand the community for whom the program is being undertaken. So you have to initiate the dialogue with the community members. So first thing is that you have to make a team and initiate the dialogue that you are going to organize certain things for the community, and you also understand the interest, felt need, resources available to you, and the level of understanding, their perception, how they feel, how they think about that thing, and views about that program. Then you identify all the available resources with you in the community and plan the best use of their available resources. You will have to plan how you are going to use these resources which are available to you for the best interest of that particular program. You also form a new and identify the existing community-based organizations like self-help groups are also there. There can be village development forums or village health and sanitation committee. You have Mahila Arogya Samiti in the villages. So to whom you are going to involve them in the program activities and provide training if needed. You try to create an environment in which the individual can empower themselves to address their own and their community's health needs. Then you promote the community participation by developing partnership with the community. Also promote good leadership and democratic decision making. Enable the community to better govern itself, better play a catalyst role. You make them trustworthy so that they participate. So now this is one of the example. It is given even in the blog also, that when you are mobilizing in the community, first of all you mobilize community based groups. It can be village health sanitation committee, it can be Mahila Arogya Samiti, or any group of people who are active in the community and form the village coordination committee. Then you endorse the village coordination committee through panchayat. As we told that panchayat is there. So at that level you determine the health needs of the community by doing the health need assessment. Then you identify the key health issue. What all health issues are there in that community? Based on the health issues, you plan the intervention. What can be done? There are so many problems. Out of that, you prioritize the problem and then you plan the intervention. What can be done? Then implement that activity or the intervention which you have planned. Implement it and then build the capacity of the community-based organization. You improve the access to health services. You try to see that this is the need of the community, and as per the need you are providing health services. So that is going to give benefit to the community, and then village coordination committee independently manage the health activities as well as sustain the health gain. People are gaining in terms of the diagnosis, in terms of the treatment, so that means they are getting benefited. So this way you can go step by step. So there is a Chinese poem, it is go to the people, live with them, learn from them. Because when you go to the people, you learn many things also. It is not that you only have every knowledge and you can only teach them. You also learn many things from them. So start with what they have. Build with what they have. But with the best leader, when the work is done, the task accomplished, people will say, we have done this ourselves. Although you have tried to mobilize them, you have tried to create awareness, you have tried to make them participate in your program, but once they have been strengthened, so you were a single person, but they are in a group and they say, we have done this ourselves. And once they have done it themselves, so they are developing that community, they are developing that particular area where you have worked. So for all these things, other challenges are the qualities of a health worker. For all this social mobilization, you need to build these qualities as a health worker, because a social mobilizer is one person who mobilizes relevant segment of the society, decisions and the policy makers, opinion leaders, bureaucrats and the technocrats, professional groups, religious associations, commerce and industry, communities and individuals. So he should have respect towards the social culture, social values. You have to respect the faith that the community has potential to take decisions and shoulder responsibilities. So you need to have good communication skills, good facilitation skills. You should be active listener, committed in your work, decision maker. You should be active, negotiating skills you should have, known to the culture and the values of the society. You should behave like a catalyst for these reformer, non-judgmental, good management skills. You need to be responsible, honest, knowledgeable, social. You should be good observer. You should be having quality of a leader. And with that, I wish that you must have gained out of this session. Thank you very much.